This is the exercise to make sure we have proper anterior knee stabilization. So what we're going to do first of all is find the shin bone directly underneath the knee, slide off towards the outside, and then we're more or less in the right place, but we can double check. If you lift your foot up, you should feel the head of the fibula is moving your fingers forwards here. That's how we know we're in the right place. So I want you to stimulate there for around about 20 seconds. You can move around slightly where it feels a little bit tight and a little bit tender, but it needs to be in this location. And then after 20 seconds, we need to show the brain what we want it to do, which is reconnect to the lower fibres of the quads. So it's okay to hold onto the wall if you need to. Lift the knee up just below 90 degrees and keep the foot nice and floppy. The foot's forwards in relation to the knee. Things to remember with this exercise: don't let the knee drop below 90 degrees. Keep the foot nice and floppy, so don't point it up or down. And make sure you're not slouching backwards. Some people do that. Hold that position for 20 seconds. And then if we do the same on the other side, so put the left foot on the table or chair, whatever you're using, find your shin bone just under the knee, slide off towards the outside, double check if you need to, and then stimulate. Again for around about 20 seconds, and then you would stop, and then straight away we want to remap your brain to the lower fibres of the quads on the left. So just like before, the knee is up just below 90 degrees, the foot's forwards in relation to the knee but relaxed, and we're not slouching backwards in our lumbar spine. Hold that for 20 seconds. Every day for 2 weeks, and what we'll find is that your brain will no longer be using these muscles to try and anteriorly stabilize the knee, which they couldn't do anyway. It means that they're no longer going to be part of the equation as the quads rightly take over the lower fibres. So this, which has been tight and short, this actually, if you remember, attaches to the medial border of your foot. One of its jobs is to supinate your foot, which means it turns it in like this. When your foot is like that and you weight bear, everything collapses in. So we get stress on the inside of the ankle and the knee. Muscles here on the outside of the hip have to work harder to support it. And then quadratus lumborum in the lumbar spine gets tight and short to protect the spine, but it hikes the hip up and externally rotates it. And that's the biomechanical position that you've been moving forwards through life with. And that's what we're changing. All of that starts to disappear. You start to weight bear neutrally once this stops overworking, because it starts to return to its normal then. It's no longer pulling your foot like this in neutral. Your weight bear normally takes away stress from the inside of the ankle and the knee. These muscles do not have to work harder to support the hip. Quadratus lumborum, QL, does not need to get tight and short to support the spine, therefore it's not hiking the hip up, it's not externally rotating it. And your knees obviously will be happier too, your low backs and your hips will be happier too. Every day for the next 2 weeks, see how you get on.